Hello medicos. In this video I will be going to discuss about the midgut. Okay, this is the midgut. See this diagram. We show the primitive foregut, midgut and hindgut. And dorsally the structure is present called primitive dorsal mesentery, through which the dorsal aorta passes and gives the branches to the foregut, midgut and hindgut. Foregut having the blood supply by celiac trunk and midgut through the superior mesenteric artery and hindgut inferior mesenteric artery. We'll discuss the midgut in this video. Okay, see this tube. This is an midgut tube with ventral convexity. Ventral it is convex. Okay, because midgut tube herniate to the extra embryonic cavity. Okay, because the abdominal cavity is occupied by liver. Liver is growing, so there is no space to grow the midgut. So it herniate through the abdominal cavity into the extra embryonic cavity. Okay, it is called as physiological hernia. It is called as physiological hernia. It occurs generally at 6th week. Okay, coming to the next. Okay, this is an midgut tube which is having the blood supply through the dorsal aorta by an artery called superior mesenteric artery. Now, the superior mesenteric artery divide the midgut into pre-arterial segment and post-arterial segment. Okay, now the pre-arterial segment having the parts like duodenum below the major duodenal papillae, below the major duodenal papillae, and jejunum and ileum. What are the parts of pre-arterial segment? Duodenum, jejunum and ileum. Duodenum below the major duodenal papillae. It comes under pre-arterial segment. Now, post-arterial segment. Post-arterial segment include terminal ileum, cecum, appendix, and ascending colon and 2/3 transverse colon, which come under the post-arterial segment. Now, the thickening of dorsal mesentery occur. The thickening of dorsal mesentery occur and give a band which is known as superior retention band and inferior retention band. Very important. The superior retention band, it is occurred due to the thickening of primitive dorsal mesentery, which gives the ligament of Treitz, which could be important for separating or differentiate between the upper GI bleeding and lower GI bleeding. Okay, ligaments of Treitz or suspensory muscle of duodenum. It extends from duodenojejunal fracture to the right crux of diaphragm. Ligament of Treitz extend from duodenojejunal fracture to the right crux of diaphragm. Okay, now inferior retention band occurred due to the thickening of primitive dorsal mesentery and it formed the phrenicocholic ligament. Okay, now the extension of the midgut into the extra embryonic cavity, which is known as vitellointestinal duct, which should be disappear, but in 2% of population the proximal part of vitellointestinal duct persists in the anti-mesenteric border. Okay, opposite to the mesentery. See, suppose this is a mesentery and opposite to this is anti-mesenteric border. Okay, now it is called as Meckel's diverticulum. Now, coming to the measurements of Meckel's diverticulum, it is 2 inches long, 2 feet from the ileocecal wall, and 2 types of tissue present in the Meckel's diverticulum. One is gastric tissue, one is pancreatic tissue. Meckel's diverticulum sometimes confused with the acute appendicitis. When we open the abdomen, if we see the appendix, if the appendix is not inflamed or not affected, then must see for the Meckel's diverticulum. Okay, now next, coming to the vitelline cyst or enterocystoma. When it occur, when both the ends of the vitelline duct form the fibrous cord, and the middle part form the cyst. Okay, which is called as vitelline cyst or enterocystoma. Okay, coming to the vitelline fistula or umbilical fistula. The entire length of vitellointestinal duct remained patent. In Meckel's diverticulum, only proximal part of vitellointestinal duct persist. In this total vitellointestinal duct remains patent, means open. Okay, so it will be direct communication between the umbilicus and intestinal tract. So what happened? The child come to the OPD, and the mother will say that the fecal discharge around the umbilicus. This is the major chief complaint given by mother. Okay, it is called as vitelline fistula or umbilical fistula. In this entire length of vitellointestinal duct or vitelline duct remain patent. So there will be direct communication between the umbilicus and intestinal tract, and fecal discharge around the umbilicus occur. Okay. In this video, that's it. In next video, we will discuss about the rotation of midgut and anomalies. Okay. Thank you.